Very happy evening, friends. Very happy to have you all here in this evening. We are going to have the our 32nd webinar today, and we are having a wonderful person here to do this webinar for us. I am K.S.Varier from K.S.Varier Ashtanga Ayurvedics Private Limited. I act as the executive director of the company. The company K.S.Varier Ashtanga Ayurvedics Private Limited was started in the year 1936 by its founder K.S.Varier, who happens to be my grandfather. I'm proud of it. So K.S.Varier started this institution with an aim to serve mankind. And that is what we have been doing all the while till now. Today it is 86 years and the 86th year is running and we are going strong. K.S.Varier found his strength in practice to serve. And he started his service in 1936 to go on, and he went on. He passed away in 1990, leaving the baton to all of us to handle. The sons and the grandson took over, and now the great-grandson has also joined. So the company handles Ayurveda. It handles products from Ayurvedic circle. We have the classical products and the proprietary products. We also have herbal foods, which are licensed under the FSSAI, and we market our products through doctors who are eminent practitioners of Ayurveda, and they all use our products and have commended that our quality is good. And we carry on with practice also in our clinics in Trichy. We have 3 clinics here in Trichy, and practicing doctors are there, which includes my uncle, my son, and a few others. So K.S.Varier Ashtanga manufactures about 200 to 300 products. We are licensed for 450 products, but we manufacture only about 300 products, and we practice medicine as such. We have patients from all over, maybe all over the world, I can say, because we have patients from England and even in the US. So this is our background, K.S.Varier Ashtanga Ayurvedics Private Limited, and I'm a proud member of this family called Ashtanga. Coming to today's session, so we have a session on integrated dentistry. What is integrated dentistry? Integrated dentistry is a type of dentistry that approaches oral care from a holistic perspective, treats oral problems by not only focusing on mouth and teeth, but also paying attention to the other aspects. So other aspects of health, like the mental, the emotional health of the patients. Integrative dentistry uses a combination of various modern day as well as traditional alternatives in curing oral adverse conditions. It has a long list of benefits related medicine.
I want to interrupt here. I think there is some technical issue with the recordings. Yes, please continue.
Okay. So Dr. Lavanya M. Rao is a dental wellness consultant at Institute of Ayurveda and Integrative Medicine, Healthcare Center, Bangalore. Her profile includes that she is a graduate in dentistry from VS Dental College, Bangalore, with a bachelor's degree in dental surgery. She is currently working as dental wellness consultant. She has spent over 5 years providing quality dental care treatment and is thrivingly practicing integrative dentistry, working hand in hand with Ayurveda specialists to provide not just disease-oriented dental treatment, but also to ensure an overall holistic dental care. Promising a more preventive approach, she provides her best expertise in the field of dentistry and aesthetics with a conservative touch of Ayurveda. She has volunteered in several outreach programs promoting dental and medical awareness across the state of Karnataka, I believe, with a diploma in neuro-linguistic programming and conversation and persuasion skills. She projects her excellence in counseling towards a positive influence on health and wellness. I think we have the right person here to talk about wellness more than dentistry, wellness, and all over. So that's a short profile of Dr. Lavanya. I think I have to hand over the session to Dr. Lavanya because that is what we are waiting for. Over to Dr. Lavanya.
One second, I would like to add here that Dr. Lavanya and me, we've been working on, along with Dr. Arun Banu, who's also here. We three have been working together in integrative dentistry in Bangalore. And we've been trying our hand on many things. I think what she has in store for you has some details of what we've been doing. Yes, Dr. Lavanya, please
So
take over.
that's Dr. Girish, who usually does the session, not me, but I have just taken over for him because he was busy. So over to Dr. Lavanya.
Yes. Hello, everyone. First and foremost, thank you so much, Sashihar and Dr. Girish for the wonderful introduction. So, yeah, without further ado, I think I would take this time to just kickstart with our session for today. And that could give, more introduction to what I am going to speak about today. I hope my screen is sharing. Yeah, okay, perfect. So today we're going to see what exactly is integrative dentistry and why it is a glimpse to the future through the past. Ayurveda has been the very old science of India, and we have somewhere, catered it, nurtured it for it to grow further and further. But integrating it with the sciences today, that's something that we are planning to do today. Okay, so first and the foremost, I'm going to start off with what exactly is integrative dentistry. This is just a brief introduction to what I'll be covering and why is it needed, when can it be implemented, and how exactly to implement it. Let's see what exactly it is first. So integrative dentistry is basically why the word complementary is because we have been using normal allopathic dentistry has always been an allopathic branch. We have been seeing like, all the treatments and procedures. There has never been a approach from the Ayurvedic side, but there is an excellent background of Ayurvedic medicine that can actually influence this dentistry. So what we try to see is that how we can visualize one particular disease from all different possible angles, not just not just from what we see in when the patient is lying on an oral, on a dental chair. Whatever we see orally, we can see much more of it. We can see the entire gateway to their entire body from just, from their oral, diagnosis. Why we need integration? So we all know, like most of the people here, we know that our body is comprised of a prakriti. So Vata, Pitta, and Kapha are the main ruling prakritis, which basically holds together our body along with our surroundings and our, compliance with the nature as well. Why we need this integration is because we are trying to see some particular disorder as an independent disorder, which we are only getting temporary solutions for. But if we are able to see it as a whole, when we see things which is completely brought together as a whole body, soul, mind, we get further answers which are more long lasting and more effective solutions. And why the mouth is actually the most important part of our body. Whatever is happening inside the body is basically visible from our mouth if diagnosed at the right time. And these things can be diagnosed with very intricate and fine details with the help of Ayurveda, which we can actually decode to get a further better solution for a better living. When and who can go for integration? Well, we'll start with our toddlers and children. Okay, so kids, from the earliest time when a child has to be brought to a dental clinic is when the baby is 6 months old. That is when there's the first initial tooth germ starts budding out. So that's called the pre-eruption phase. From then on, it is very important to nurture this entire process of the eruption of the tooth, which is basically the teeth coming out in the mouth. And for kids, we have like many solutions which just by seeing from a dentistry point of view, we might not be able to give a long lasting or an effective solution with which the child is also not traumatized by a dental clinic. So rampant caries and habit breakers. Rampant caries is basically something that we see in small kids, which is also called like this nursing bottle caries, which is a very big problem in dentistry, because technically there is not much we can do about it, and other than just wait for the milk teeth to fall off and wait for the permanent teeth to come. But through Ayurveda, we are at least able to give the kids easier way to deal through it, and also a prevention towards these kind of decays. And then we have our teenagers and young adults, for whom integration and wellness can be a very important part because of the biggest concern of oral hygiene. Teenagers usually are so engorged in their lifestyle, and young adults, of course, they have the thriving nature to make a living and everything. They usually tend to forget about their oral hygiene. Not just oral hygiene, just hygiene and wellness in overall is usually neglected because of other other situations in life. But this is the time where the maximum wellness is required, because this is where the development occurs, and further on this is what is going to decide the age of our teeth, whether it's going to stay for until the end or not. Okay. And finally, the middle age and the elderly. Of course, there is a lot of age-related changes in dentistry that has been observed, and usually it is said that okay, it is an age-related change. You just have to deal with it. Everybody ages. These are the common dialogues that you get from a dentist when you go for certain problems, like your teeth are starting to become loose, or your gums are starting to wear off. Your bone is starting to wear off. But there is a small thing that age is just a number, and Ayurveda has been able to make it true that age is just a number. Whether you're 30 or you're 50 or you're 80, it does not really matter how far your body is aging. Your body's age is determined by how well you maintain your wellness, hygiene, and how you are dealing with the problems when disorders of your dental health and everything, how you're dealing with it. It is completely dependent on that. Now we'll go to how to implement this integration, the most important part of today's session. Firstly, it is not just, a dental visit is not exactly just a place where you come there and tell about your teeth. The first thing that you need to analyze as a doctor who should be analyzing is what exactly is the lifestyle of the patient. If a person comes to you with a dental issue, the first questions that we usually ask is what exactly is happening, from how long you have the toothache, or from what kind of this thing. And most of the dentists just stop at that. They stop at asking what exactly is the problem, and they focus only inside the mouth. But actually, that is not the case. When we try to look at an entire lifestyle, starting from the time they wake up, from the food they eat, what time they eat, and how much they eat, what exactly they eat, all these, including their bowel movements, their lifestyle, their work, their stress levels, all these has a major impact on how their teeth is responding. Not just teeth for that matter, the entire body responds to every single action, and not just your action, but also a thought process that's running inside of your head. Most of these are called as the psychosomatic diseases or disorders, which means that your body's, your thoughts decides what your body exhibits from outside. So first thing is we need to make a lifestyle analysis. Beyond that, then we go for the examination, we go for the diagnosis, where we try to see, figure out what locally is causing any kind of issue. Once we have figured out what is the local factors that is involved there, like maybe a tooth decay or maybe some bleeding of gums or anything like that, then we go to analyze what are the routines of the patient, what exactly they are doing. Probably a patient, for example, if a person comes saying that they are having extreme sensitivity in their front teeth, and usually people will be like, okay, they'll try to figure out if there is any decays involved. If there is no decays involved, they're just going to see if there is some kind of wear and tear of your teeth, where the enamel is the outermost layer of the teeth, which is worn out or something like that. But it's very important to find out if they are actually having small little routines, like having maybe lemon water on empty stomach early morning. That could actually cause a lot of hypersensitivity. But these small little changes, if it's not noticed, the patient will keep coming back with the same repeated issue, and will ultimately just give up on it and start trying to deal with it, suffering all their life. Once we figure out what kind of routines and patterns we have to alter, then we go for a balanced treatment plan, where we can see wherever required and functional intervention of dental treatment. Functional intervention, I mean like treatments that have that needs to be done in a dental clinic by a dental surgeon or a physician, along with medications and therapies that can be included from the side of Ayurveda, which will try to give a long-term healing capacity, regeneration, and also it would bring a touch of wellness so that the issues do not keep repeating. Once these treatment plans and therapies have been implemented, we need to check on how far they are following up the patient, if they are following whatever instructions have been told. And along with that, it is very important to counsel them, to make them realize how important this wellness aspect of their life is. So just a small brief, since the time is quite short, I just want to give you a small brief on what briefly you can see in your teeth and how you can relate it to Ayurveda. So, so this is a basic tooth analysis of a normal individual who is not ideally having any kind of disorders. So a person who is having a prominent Vata Prakriti tends to have slightly cracked or brittle teeth with a slightly dull appearance, whereas the Pitta shows a slightly bigger size, moderately sized, and slightly yellowish tinge to their teeth. The Kapha has a large, glossy, and strong, bright white hued appearance, which is usually seen like, people say pearly white teeth. So that is what the Kapha Prakriti exhibits. But yes, again, we cannot individually separate out these kind of Prakritis, because most of the people, or I should say like almost all of them, will have a combination Prakriti. And the most, in Indian population at least, the most commonly visualized the Prakritis are Vata Kapha or Pitta Kapha combinations, where because of the Kapha element being combined with either one of the other two, the teeth looks more naturally glossy and pretty in a normal condition. But when there is a prakopa of either one of these Prakriti, that is when one of the Prakriti just goes array and starts acting out, then you will see that these characteristic features of that particular Prakriti becomes highly aggravated. And that's kind of situation, even the Kapha Prakriti, the glossy, strong, bright white hued teeth can also be detrimental. And not just your teeth. When we say dentistry, people have the concept that it gets limited to the teeth, but actually the thing is dentistry involves anything about the neck, because we get to deal with the tongue, we get to see the inside tissues of your mouth, and also to an extent through the throat. And there is a single nerve that is supplying from head till the neck, which is just branching out. So everything, maybe a small damage in one part of the nerve can lead to damages in all the parts of the face. So when we see, this is a schematic diagram of a tongue, where vata, pitta, and kapha, what has been put up over there, it is basically like if you divide your tongue into three portions. The posterior most, that is the backmost portion, represents the major portion where the vata prakriti is exhibited, and between is the pitta, and last is the kapha. And what you're seeing on the tongue, what like basically your entire body is present on the tongue. It just means that these particular areas are directly correlated to those particular organs. For example, if you just go on the left top corner, you have the left kidney. If a person is presenting a recurrent detrimental or recurrent deposition on the left back corner, it could mean that it is his left kidney that is affected, which is just presenting itself on the tongue. This is the reason why I said mouth is a doorway to your health, because whatever you have in your head, your entire body, just by examination of your tongue, it is possible to decode, and at the early stage possible. The presentation on the tongue usually happens approximately at probably even a month or so before it actually starts presenting it out in your organ as such. So it's very important to maintain oral hygiene, first thing, and second thing, to keep a keen observation of any kind of changes that you are observing that is present on your tongue, teeth, or inside your mouth. So the other side schematic, I think it's pretty clear, like the depositions, what has been presented on the tongue, they represent like the fourth one. You see that there is on the lateral surfaces of your tongue, if there is a thick deposition, it means that the person could be having delicate lungs, and also they could be showing they could be showing kind of depression on your tongue, like depression in the sense it is like you will feel that the tongue dips in the end. So in this kind of this thing, it is a clear indication that there is some issue with the lungs. So this is just an example. Further information about it, I would like to save it for another time. Okay, so treatments. What exactly, how do we integrate in treatments? So we have a lot of the dental treatments. Of course, most of you will be aware of that. The moment you go to a dentist, they will say you need to get a cleaning procedure done, which usually they call it as scaling, or maybe a filling, root canals, etc, etc, etc. But what can you do at home? Hygiene therapies, and under the guidance of a doctor. Basically, you have Ayurveda speaks about Danta Dhavana, which is basically like your brushing of your teeth. And Kavala Dharana is like mouth rinse, but you just hold it in your mouth. And Gandusha is basically similar to oil pulling, where you swish inside your mouth a particular oil or a mouth rinse or any kind of preparation that is prescribed for you. And Pratisarana is basically a gum massage, or need not be gum exactly. It can be on any surface of your oral cavity, whichever is required for you in specific. And there is Charvana, which is basically chewing. All these are hygiene therapies to maintain a normal oral hygiene. And at the same time, these can also be implemented in case of any disorders, which the doctors would prescribe it to you with along with certain medicated herbs, so you can use that to get out of the issues. Treatments. Ayurveda has started speaking about dental treatments much before dentistry actually even came up with these treatments. So, well, I would like to say about this Danta Mamsa Chedana, which in our dental terms we have termed it as gingivectomy. It is basically a surgical procedure where we deal with the surgical cutting off of the gums. It's in a very layman's term that I am trying to explain this, but yeah. So these kind of procedures that are done in under the complete guidance of a dentist has been followed even in Ayurveda without the usage of excessive invasive procedures. And yes, so we have procedures like Agni Karma, which has it's basically like cauterization. So in dentistry, we use both cold cautery as well as as in the cryocautery as well as electrocautery. And these things have been done in Ayurveda using certain kind of herbs, or not just herbs like jaggeries, all these kind of element. That was just an example, but many other elements have been used. And nasya, which people might be aware, the picture shows that you are putting drops into the nostrils. So this also affects on your teeth and your gums and all of your oral cavity. You are able to achieve certain kind of health and recovery and repair just by doing these kind of procedures. Rakta Mokshana is one interesting technique that has been shown by Ayurveda. As far as I know, one of the Rakta Mokshana procedure in Ayurveda involves leeches, whereas when we try to do integration, we have something called subgingival scaling, and where we we try to clean within the gums, and there is excessive bleeding that has been created at that point of time, which also acts in the same way like Rakta Mokshana acts. So this is just an example to tell you how integration can be beautifully implemented in a dental clinic, or under the guidance of of a known practitioner. So before this is just a brief introduction to what integration could be. I would like to share a couple of success stories with you, where we have found that integration has given a better, much long-lasting and effective results with the least trauma induced to the patient. So this is one of my case that me, Dr. Girish and Dr. Arun have been working on. And yeah, a person who is 48 years old who had loose teeth in most of his behind teeth, all of his big teeth behind were all shaking almost 4 millimeters front and back. And he had bleeding gums, had bad mouth odor. His main complaint was that he's unable to confidently speak to people because of the mouth odor, and he usually has trouble with chewing any food because he's unable, because all the teeth starts shaking, and he doesn't it's associated with pain, and also he keeps getting a lot of ulcers. So when we went for examination, like the first two photos, we are able to see that there is some kind of inflammation, that swellings on the gums, the redness, the health of the gums itself show that they are not capable enough to withstand the load that the tooth is taking on it, even for chewing normal food like rice, dosa, idli, all that. And at the same time, you can also see that the gums have gone so much back because of the load. This is called recession, where the root of the tooth is almost exposed up to the tip of it. So the worst part of this situation is that it shows that there is absolutely no bone also that is supporting these teeth. And any point of time, these teeth can actually come out, which could cause severe pain, because we still have the wiring upright inside the teeth. That is, your nerve supply and the blood supply inside the teeth can actually break when, if in case these teeth fall out. So when we checked for all this, uh, there was also another thing, that there was a lot of deposits and stains that was creating this kind of gingival health. And these periodontal pockets are basically pouches of bacterial bacterial flora that has got infested over there, and they are proliferating from within. So what exactly is BOP? That is basically bleeding on probing. As in, whenever we probe the gums, there is severe excessive bleeding, which is not a healthy sign. Halitosis is nothing but a bad mouth odor. So we went for a treatment plan. Okay, before we go for the treatment plan, I would like to just tell you briefly about the X-ray over there. You can see at the points that is marked in blue, the bone has been gone back to the extent that the adjacent teeth also do not have a single side support. All the bone that has come completely down, they are not even supporting the tip of the teeth, which is making all these teeth start shaking excessively. So we went ahead for a treatment plan, which included from the conventional aspect, we, like I said, the subgingival scaling and root planing, which are certain procedures by which the cleaning, the deposits and the stains, all that has been removed. And we instigate the gums to start a healing process. And there is interproximal irrigation. We use peroxides and basically antiseptic solutions, with which we can just clear all these pockets, the periodontal pockets. We can just flush it out, so that there is the bacterial flora is kicked out from that place. And non-surgical abscess drainage wherever necessary, because abscesses are small little pus-filled swellings, which needs to be the pus needs to be drained out. Otherwise, it can cause severe bone loss in that particular area wherever the abscess has been formed. And side by side, along with the conventional procedures, we also had the Ayurvedic intervention going on, in which we actually gave him orally some medicines like Gandhathaila capsules, Arogyavardhini Vati. These were always given like in periods of time. Like if we start off with some particular medication, we would go about with it for a month or two, or maximum of 3, and then shift to another medicine, whichever is required based on the recovery. And topically in the sense, the Pratisarana and Pralepa kind of treatments. So we had exposed him to Pitaka Churna, Lakshadi Churna, Sudha Kalpa, which all these agents where he had to give a gum massage for himself as well. And we would have a periodic check of how exactly this is improving. And we had like mouth rinses with Triphala, Arimidadi Thailam, oil pulling, Sluice mouthwash, again, proprietary drug from Ayurveda. So all these kind of medications was exposed to him, and he was following it up for a period of almost 10 months. That is when we took, like, it's still an ongoing case, and he's still following up with most of the medication. That is simply because of the results that he started seeing. So from the first month itself, he felt that the mouth odor, which was his main concern, well, because for his confidence, that had come down, and his oral hygiene overall had improved. By the time we reached the 3rd month, we observed that the mobility had reduced. Mobility of the teeth, whichever teeth were showing 4 mm movement front and back, had gradually come down to 2 mm front and back. And they had started becoming so firm that even the tissues around it started looking healthier. The swellings had come down, and the tissues around it had stopped becoming very flimsy. And from the 6th month onwards, we observed that there was absolutely no bleeding when we were probing near the gums. And the accumulation of deposits also had reduced to a very large extent. The ulceration, which was another problem for him, the ulcerations had also stopped completely. By the time we reached to the 10th month, the teeth that were actually moving front and back 4 mm, for which most of the doctors had told him that he needs to get it removed and go for just like removable dentures or something, these teeth had become completely firm. They were not moving anymore, and he was comfortably able to chew whatever food he desires. The gums around it had become healthy. You can see in the pictures that they have turned light pink, and also they are extending to at least covering up 1/3 to 2/3 surface of the teeth. So basically there was new tissue that has been formed over there. And this in the X-ray also, you can see that there is a lot of, there is a haziness around the tooth. Wherever the blue marks are there, there is a hazy light radio opacity which is visible, which is actually a sign that there could be new bone formation. In a person who is aged 48, yes, there was something like a new bone formation, which ideally we believe that post the age of 25, we do not see any bone growth. So this, so we are suspecting the entire treatment, how it has acted is that it has not just reduced the infection and the swelling, but it has also nourished the tissues and increased the blood circulation to an extent that they are able to regenerate and reproliferate. Basically, which means that we have taken it down by its age, at least around 20 years back. So further ahead, I think the improvements will be even much, it is a constant improvement. It is not going to stop with this, because we have helped the teeth to repair itself. We are not making it repair with whatever we are giving from outside. So once it starts healing itself, that is a procedure, that's a process that we cannot stop after that. It's just going to repair itself no matter what. Another case that I would like to share, this is a female patient who came to me with severe toothache. And I believe what her issue was that the decay was so deep that she had visited a dental clinic previously, where the dentists had told that she had to go for a root canal. But unfortunately, due to unforeseen circumstances, she was unable to go through the entire process of root canal. Like there are two teeth that was really causing her a lot of trouble. The upper one shows, so I don't have the earliest before pictures. I'm so sorry about it, but I have something that, after getting some kind of results. But the down picture that you can see, they had basically tried to open the canals as well. And because she was unable to tolerate the pain, because no anesthesia was working on her, they were unable to go ahead, and they just had to leave it open for her, which was also extremely painful because your nerve endings are left open. But once when she came here, after looking at this condition, what we did was again a treatment that first initially the basic cleaning, the saline irrigation, and whatever the pus was there, it was drained out. And with the mild formocrystal dressing, formocrystal is an agent that we use for desensitizing the nerves temporarily in that particular area. So that was mainly done so that the pain subsides immediately. And mild analgesics, like analgesics is nothing but the painkillers. So mild painkillers have been given to her so that she can tolerate the pain for that period of time until the Ayurvedic medicines act sufficiently for it to heal completely. Along with this, we also gave her, during that same period itself, we also started with something called Lepana of Vajradanta Churna, which was a small piece of cotton that was, placed with the paste of this Vajradanta Churna with Lakshadi coconut oil. And it was placed inside these cavities, and she was sent back with the medication, oral medication. Also, a certain medication from Ayurveda, which acts for reducing inflammation, reducing the bacterial activity over there, and thereby reducing the pain. Over a period of 1 week, initial 1 or 2 days, she was having so the painkillers were exposed to her only for a period of 3 days. And post that, she did not experience any pain even after discontinuing the painkillers. And in 1 week period of time, she actually returned back showing, so what is marked with the blue arrows, these are actually new tissue, what we call as reparative dentine. Reparative dentine is nothing but the layer of your tooth that is usually formed when it is triggered with any kind of trauma. And it is basically a protective layer that tries to hold back your nerve endings within it so that there is no further deterioration of the tissues. So this reparative dentine formation gave us a scope that from there on we could apply calcium hydroxide pulp capping, which is again a dental procedure, post which we give it, it's a kind of medicated filling. And once the medication acts on this same reparative dentine that is there, it will be a strong firm layer above which we can actually replace this temporary filling with the permanent filling without taking this tooth for a root canal or a removal. So this was one more success story where we can say that it is, we can confidently try to avoid a root canal and try to keep the tooth alive as long as possible. And in due course, when necessary, what action needs to be taken has to be taken. But until then, trying to keep the tooth alive is an important stage here. Another main issue that we see in most commonly in the Indian population, most of you might have seen the kind of teeth that is illustrated in the first image here. Severe stains, a lot of deposits. The deposits are to the extent that the gums have gone down. The gums are completely in a bad shape. There is excessive bleeding. The moment we touch the gums, it is going to bleed. And this also will lead to severe sensitivity of the teeth and burning sensation on the gums as well. So when the patient presented with this, it's a person who is 43 years old, and he said that there is severe burning sensation. He is unable to have any form of food. So first thing that we did was that we started off with the scaling procedure. That is, first get rid of all these bacterial activity that is happening on top of these tooth surface. All the microbial activity that is happening has to be removed. And then we go ahead about with the peroxide flush. Peroxide flush is a simple procedure where we try to induce more oxygen inside these gums. And since these microbes are all actually anaerobic, that is, they cannot survive in the presence of oxygen, it basically gets killed, and it gives an antimicrobial effect. So the Ayurvedic intervention was the more important part for this condition than our regular treatment, because our regular treatment can only bring us up to this. Beyond this, we can only tell the patient that you need to brush twice, maintain oral health, visit for checkups regularly, and all this. But with Ayurveda, we were able to give one more step ahead as recovery of these gums. So the pralepa that we had suggested for him was again with Vajradanta Churna mixed with Sudhakalpa. All he needed to do was apply it on all over his gums and leave it overnight. And also it was accompanied with oil pulling procedure with Murchita Tilataila, which had a very healing action on healing and regenerative action on these gums. Orally, certain medication to bring down the toxins in the body was given, like Arogya Vadini Vati, and a few other medications were also introduced, but I've just given a brief on over here. And within a couple of, I think I saw him again after 2 weeks period of time, where there was improved oral hygiene. There was no bad breath. The bleeding had stopped almost completely. And the burning sensation was absolutely not there. The patient came back happy, telling that I am feeling very comfortable. I'm able to eat whatever I want to. And my teeth and my mouth feels good. And not just that, I feel even more like I feel that my stomach also feels good. My appetite has become better. So he gave all these kind of things, which just because of the oral hygiene that is got maintained, it has in turn led into his entire system becoming better. And this here in the second photo, you can see that the stains are completely absent. The gums look more pinkish, and only in certain areas where healing is still taking place. Other than that, all the other places, the gums are firmly holding, adhering to the tooth, which is the main motive for us for after this procedure. So periodontal and gingival degeneration has been completely reversed in this condition. So these are certain, a couple of few stories we have. So we have been dealing with so many other similar stories, but these are the ones that I was interested on showing it to you today. And so this is basically like what all we have covered today, that what, why, when, and how. And if any of you are having any questions for me, I think this would be the good time to go about for it.
Thank you, Dr. Lavanya. So that was a great session. It was brief as well as very informative. So for anybody, a person who's new to the Ayurvedic side of dentistry, most people are, they would have a question, which is, I have heard dentists say that the Ayurvedic tooth powders can harm the enamel of the teeth, and so they are to be avoided. What is your opinion?
It is not the powder that is harmful. It is the way you use it that can be harmful. So the first thing that I would say is, any particular thing, when it is taken as a medication, it has to be under the guidance, under the supervision of a professional. Any kind of powders are to be mixed with or made into a paste, and they are never supposed to be rubbed on your tooth. That is one big mistake that people do. They feel that, okay, my teeth will become clean if I nicely put force and rub my teeth. That's not the way to go about it. These preparations are exclusively prepared for application and gentle massage. They always mention gentle massage. There have also been questions. Some of my patients come to me telling that in olden days they were using charcoal. Why can't we use charcoal today? In olden days, they never made charcoal out of carbon, the charcoal sticks or the carbon that you get now. The olden days, the preparation of the charcoal itself was very different, and it was completely natural. And whatever they were using it, they were not rubbing the teeth with the force that people assume that it needs to be rubbed with. So I think powders are safe to use, but you should first find out which kind of powder is required for you, and because there are plenty preparations. And second thing, how exactly you need to do it. and when exactly you need to do it. Not all conditions are okay for every single person.
So I'd like to add something here. Now, Dr. Lavanya's details are there on the screen for you. If you need to get the details, please, there is a QR code you can scan, or there is an email ID to connect with her. So if you all have seen through that, we'd like to close down the screen sharing so that we can interact with the doctor directly.
Yes.
Is that okay, doctor?
Yeah, perfect with me. And
Yeah, so I think we
so,
can close down the screen sharing.
yeah.
So
Yes.
now I also want to add, Dr. Lavanya was talking about the right advice with the right person. So in Ayurveda, people don't know that there is a part called dentistry, which is part of Shalakya Tantra. The post-graduation I've done is Shalakya Tantra. I'm an MS in Shalakya Tantra. It's a surgical degree. So in Shalakya Tantra, we have eye, ENT, as well as dental issues. We take care of all these three. Now, very few colleges have good exposure to dental side of the Ayurvedic this thing. For that, I should actually thank my teachers, Dr. Ashwini MJ, Dr. Dheeraj BC, Dr. Amarnath HK, Dr. Abhijit HN, Dr. Gurraj Anil Bhatt. All of these people have exposed me very well to Ayurvedic part of dentistry, and thereby my foray into dentistry, and thus connecting me to Dr. Lavanya. Also, some medicines she had mentioned, I'd like to mention here. One is Sudhakalpam, which is a proprietary product of K.S.Varier Ashtanga Ayurvedics Private Limited. It is a unique product. It is one based out of ghee, and that is why it can be used in the mouth as well. So that is there. And then there was this product called Sluice mouthwash, which is a product of Ayurveda Private Limited. That's another company. Also, there is another product called Vajradanta Churna, which is actually made by Ayurveda Ashramam from Chennai. Dr. Sri Krishna Desika Charlu is the proprietor for that, and as well as his mother, Dr. Jayashree, who are sixth. Sri Krishna is actually the sixth generation Ayurvedic physician. So they've been doing a lot of work for Ayurveda for the past 6 generations, 150 years around. So that's another thing which got us very much interested into the Ayurvedic side of things. So with that, I'd like to ask Dr. Lavanya to continue answering questions. There are a few more questions.
Yeah.
Another question is preserving tooth. What are the advantages you are experiencing after practicing integrative dentistry?
So preserving tooth is actually the main thing that I started experiencing after I started with integrative dentistry. Like the reason why I have approached to integration was because there was a recurrent, the certain conditions are not completely answered by just dentistry. What actually happens is we are able to give a solution on a temporary basis, but over a period of time that tooth is going to deteriorate, or maybe the gingival health is going to deteriorate. And these kind of conditions pushed me towards integration. And once I got into integration, I just realized that root canals and removal of your teeth is not the only solution, that is available. There is another major aspect where you can actually try to keep the teeth alive for as long as possible. Everything has an expiration date, agreed, but if a person is coming like the example that I had given, that a person of 37 years old who would have actually ideally got 2 root canals, she has 2 healthy vital teeth right now. So this kind of preserving of the tissues or preserving of the tooth is a very integral part of this integration. When we are using Ayurveda, we are able to see that without removal of these kind of tissues, or without causing any kind of invasive harm to these tissues, we are able to preserve it. We are able to preserve it in its good shape. That basically is the wellness that we speak about. So this kind of wellness is actually possible only through integration. It is not one particular science you have to look at. You have to see how you can combine all the possible sciences that you have with you.
I would also like to add this webinar would not be complete without mentioning Dr. Vaibhavi Joshipura, who has led us into this integration. She is part of Answer Healthcare Bangalore. She started this foray into integrative dentistry, and Dr. Lavanya is a student of hers, along with Dr. Sukumar, who is an Ayurvedic Shalakya specialist who has given us their guidance into integrative dentistry.
She has been the mentor. She has been the mentor, and we are just following her footsteps right now.
I would also like to thank my principal sir also to support me into foraying into dentistry, Dr. Prasanna and Rao, SDM College of Ayurveda, Hassan. Also, Dr. Lavanya, I would want to thank another person, Dr. Arun Bhanu, without whom this would not have happened at all. Dr. Arun, I know you're here. Thank you so much.
Yes, Dr. Girish. Yeah,
he is a senior research fellow.
Kind of. Yeah, continue.
He is a senior research fellow from working in TDU, Transdisciplinary University. Ganapati sir, yes sir.
Yes, after hearing the speech, I had thought of going and meeting one of the Ayurvedic doctor whom I had known previously, Dr. Ajil Kumar, who is in Pillai.
Yes,
but now that you have got your phone number and you are available in Togamada Road, of course, beyond that, I think that the Banana Research Center also. So I think I will get in touch with the phone in the next couple of days. We'll have a talk over that, and then we will see what I could be done. For I am only 83. It's quite a few more all these teeth problems. Okay, thank you.
Yes, sir. I'm actually also trying to bring in Dr. Lavanya.
The integrated aspect also was very good, though it is fairly well known. It has been very beautifully brought out by directly they telling as Vada, Pitta, Kava, etc. has to be looked at along with the problems of the oral hygiene, and not just like the eye. It is not a job only of the dentist, but a holistic integrated approach. Thank you for both of you. Thank you.
Thank you so much.
Thank you, sir. I'm also trying to bring in Dr. Lavanya for visiting consultations. I have a question from him. A point here. Excellent exposition of integrative oral hygiene, deeply connected all other aspects of body for a healthy life, from toddlers to 80+ citizens. Thanks to Dr. Lavanya and Trichy Book Club.
Thank you so much.
He is Mr. Ganapati Vishwanathan is retired from The Hindu.
83 now.
Young 83, sir.
I'd like to interrupt here. Yeah. So, okay, I was just noticing that the recording had now it is continued. So, another thing is, okay, I have another question. What is your advice for young adults with impacted wisdom tooth?
Yes. So impacted wisdom tooth is again, it's a very approachable condition for integration, because we are able to preserve this particular wisdom tooth without causing too much damage. We can make it as a process that without removing the tooth, how we can try to keep it in harmony with the rest of the bone. Any kind of pain that is being observed, if it is not going to be causing any kind of further issue to the bone, then we can actually preserve these teeth inside itself, even though it is impacted. The main points is oral hygiene needs to be maintained, and at the same time, certain small little procedures that can be done in clinics and at home will bring these wisdom tooth problem as such to be, as a normal course without creating any kind of pain.
Yes, Dr. Lavanya. So that question was actually put forward by Mr. Shankaran Unni, who was joining us all the way from Canada.
Oh, wow. Okay. I hope I have answered your question, sir. In case of any further clarification, I would really like to assist you with that.
Thank you, Dr. Lavanya. Yes, you have.
I think we have come to the end of the questions which are coming up in the chat box. Anybody would like to ask questions directly, that would also be welcome. In that time, I wanted to also say that dentistry is something which needs to be, the integration part of it is very much important, because these days we are at a very young age, we are losing out on our teeth, and oral hygiene, as well as maintenance level, the wellness part of it is very much essential for us to get acquainted with and work on it. As a mass, we need to work on this. So awareness first, and then most people are afraid to go to the dentist, including me. I don't like to go to the dentist, but then things which are taken care of is what I should be thankful to Dr. Lavanya for, as well as Dr. Vaibhavi ma'am, for getting us into the preservation part of it through Ayurveda.
Preservation, yes, definitely.
Also, Doctor, there was another question which came up to me in the chat, in my personal message. This was regarding integrative dentistry. So integrative dentistry, when you practice integrative dentistry, what is the kind of response that you get from other dentists?
Okay, that's a very interesting question. So, so there are a mixed response, I would say, because there are certain people who feel that, it's not very business oriented, because obviously it is, we are trying to preserve a lot more teeth than replace them. But at the same time, there are dentists who are seeing it from a fresh perspective, and they are able to see that, this can actually bring a long lasting change into the way we approach in dentistry, especially when we go for like orthodontists, that is the doctors who actually put braces. They usually suffer with the common problem that when their braces are being put, there is an allergic reaction that happens where the gums start growing over the braces. In these conditions, they ideally do not have any kind of solution, and that destroys even their treatment line. In those situations, they really appreciate the Ayurvedic angle, the integration angle to it, where these kind of inflammation or the swelling of the gums can be controlled using Ayurvedic medication. So yeah, ideally it's a mixed response. There are people who appreciate it for the science it is, and at the same time you will have people saying that all this might never work out. So you need to find out which way direction you need to go to.
Also, I'd like to add here that the link for giving the feedback is presently active, and it is given in the chat box. I would, softly try to pressurize everybody here to give a feedback, because this is a topic which we need to put forward to the world and say that this is possible. So please give us a feedback on today's webinar, so that we get a good idea on what next to do from your side. The link is there in the chat box. Yes, I also want to, as earlier I was trying to say how this could not have happened with the help, without the help of Dr. Arun Bhanu. Doctor, would you like to comment something? He is a senior research fellow from TDU, Bangalore, Transdisciplinary University, Bangalore.
Yes. So in the clinic, we usually get people with a lot of dental issues, which we sometimes try to rectify by ourselves. Later, I realized that that may not be our cup of tea, and there should be some intervention might be required from an expert. And that through that also, if it is from our Ayurveda side, that would be even more even more faster relief or more trustworthy if the person is able to go through the same set of medicines. In between, they regularly ask, if can I have this antibiotic while taking your medicine? And such questions will not happen during this sort of integration as well. And many people are like, what I'm seeing is after like when we are doing some digestive correction and everything, the moment they go to any antibiotic course or something, there will be too much complication happen in the digestive system as well. Such things can be avoided here, and a lot of preserving things also can be done with this aspect. So this seems to be a wonderful experience in collaboration with Dr. Girish and Dr. Lavanya for this sort of dental expertise. And whenever I get any sort of this kind of confusion in the practice, there are always two people whom I can approach are with me currently. And though Dr. Girish is saying without whom this may not be possible, I too should be reciprocating the same, that without them, this won't be possible for sure. So this is such a wonderful experience for me as well, and nicely presented. And so happy to be part of this webinar. Thank you.
Thank you,
I would
Doctor.
like to add something over here. So being from the dental background by myself, for me, Ayurveda was a completely new concept. So I was interested, I was keen about Ayurveda from quite long ago, but because I have pursued dentistry, I was not very much exposed to it. And I convey my complete gratitude towards Dr. K.S.Varier and Dr. Arun Banu, without whom me doing anything of this sort would not have been possible. And under the guidance of Dr. Vaibhavi, we have been able to explore complete, new angle to our practice. And this team, whatever we have created of three of us together, has actually helped so many people. Like, I get a lot of patient reviews saying that they are completely comfortable. They feel that they are in the safe hands. So this entire gratitude goes to Dr. K.S.Varier and Dr. Arun Banu. Thank you so much for making this possible and making me a part of this.
Thank you so much, Doctor. Finally, I think we are just ending up thanking each other.
Yes.
So, Mr. K.S.Varier is the Executive Director of K.S.Varier Ashtanga Ayurvedics Private Limited, as well as he's the third generation of the Ashtanga family. Sir, would you like to comment on something?
Absolutely. Delighted to comment on this webinar today. So it's been a wonderful exposition. Right from the beginning, she has been smiling all the way and giving all the information that is possible. What interested me most was the slide on the tongue. You know, I was fascinated by the way the tongue can really expose so many things to you and about your health. Even a common man can understand what a tongue says. And it was delightful to see that slide there. All your explanations, the way you have gone through the patients and the details about the patients, the correction, all that was very interesting and very well presented. Very good language, easy to understand, easy to, you were, I think you took a very daring step in, moving out of your comfort zone of dentistry and moving into the area of Ayurveda, which is totally new to you. You learned all those terms. You were using Gandusha, you were using Kavala so easily. You were using all the names of the drugs so very easily. I could understand how deeply you must have involved yourself into this kind of work, which has really, it's a daring attempt, I should say, and going against all your basic principles of not using Ayurvedic products. So I congratulate you on this step. I'm sure this is going to take you very long. I also have, developed a cave from Trichy to Tanjavur through my teeth. So I'm afraid to go to a dentist and did not want to go to a dentist to correct that problem. So now I
So
know
now
where
you
I should go.
Yeah. Now you know that how we can close the cave.
Very true. Very true. Thank you very much for having done this for us, for Ashtanga. Thank you very much.
Thank you
Over
so
to you.
much, sir. Thank you so much.
Ganapati sir, I have put my phone number in the chat box if you have noticed it.
I've already given him.
Yeah, okay, great. So I think we are coming to the end of this session. Anybody else would like to put forth your views? You are please welcome.
So usually we have our MD, we have our the head of the clinical side also here, but they are absent today.
The medical superintendent.
Medical superintendent, he is not well today, so he is not able to attend here.
Okay.
Anyways, we'll be sharing the recordings to everybody. The recording would come up in a couple of days, and those who have put forth the feedback in the through the form, they would also get certificates. With that, we come to the end of the session. Yet another Sunday, yet another session. Excellent session we had. So I would like to thank Dr. Lavanya for taking off her time, off her busy schedule, and giving us such a wonderful insight into what integrative dentistry is. Thank you so much.
So can we also say that all the past webinars also, the recordings are available in our YouTube channel?
Yes, yes, our YouTube channel, Ashtanga Ayurvedics, you will get recordings of all the past, most of the past webinars. Earlier, a few were not there, but then we started recording after that. So most of the webinars are available in the YouTube channel. We've been doing this for the better part of around 2 years now. So we would like to continue this for giving out the, this is an initiative by Ashtanga for giving out awareness of what Ayurveda is.
Thank you, Vignesh, for being here and doing the session for us.
Yeah, Vignesh is an integral part of the whole system. Thank you, Vignesh. Without you, the webinar series wouldn't have, happened at all. Thank you so much. So I think we will come to the end of the session. Vignesh, we can stop the recording.